the child, takes in a deep breath, because that will help open the lungs out, because the lungs are like closed balloons. So you have to, the first time you blow into a balloon, you have to really give a forceful blow in it so that the balloon opens. Exactly, it's the same thing with the lungs. And then there's a certain different circulation, which we call the fetal circulation, that gets converted into a adult or normal circulation, because the fact that children don't breathe inside.
Yeah.
They get all the oxygen, etc., from the mother. So
Mhm.
the first breath that the child takes is very crucial. And if a child does not breathe at the time of birth, the first thing we'll have to do is try to resuscitate the baby to see that the child is breathing well.
Mhm.
Right?
Oh,
And
okay.
accordingly, obviously, simultaneously, we'll see the heartbeat. If there's any heartbeat less than 60 per minute, that is when we have to start chest compressions and CPR, etc. That is the job of a pediatrician at the time of birth, seeing that the child breathes well and the child has a good color and has good, heartbeat.
Okay.
After that, then we look at other things.
All right. All right. Okay. Now, if you can share some of the common problems that the newborn babies can have in the beginning, maybe you could say first 10 days, or you would like to explain a bit like for 3 months. So it's up to you, but we'd like to listen.
Well, within the first 3 days, a child can get jaundice. Now, one thing I'd like to make very clear is that this is not like infectious hepatitis or jaundice of a disease or anything. This is what we call physiological jaundice. This is, again, we come back to the breathing. When
Mhm.
the child is in the womb, the child gets the oxygen from the blood of the mother. So there's more blood or more hemoglobin in the baby than is required. So when the child starts breathing normally, the extra hemoglobin starts breaking down. When that
Okay.
breaks down, it becomes a pigment called bilirubin, which is yellow.
Mhm.
So the child becomes jaundiced. So people say, oh, you have to give sugar water and you have to put the child in the sun and all sorts of things that the old ladies and the old people want. But no, it's not like that. It's not due to an infection. It's not due to anything. It is a physiological process, unless of course there are other things that can cause jaundice, like blood incompatibility or breastfeeding jaundice, which is something different altogether. I'm talking about the normal physiological jaundice at the moment. If it is high, if the jaundice is high, then we put the child under a blue-green light, which is called phototherapy. And that light interacts with the bilirubin and lets the bilirubin pass out through the gut, and the child gets normal. Now, people think that, oh, why should we pay the money to have the child in the hospital with the phototherapy? Let's put the child in the sun. So what they'll do is they'll bundle the child up completely,
Mhm.
and only the face is outside the bundle, and they will put the child in the sun, which makes no sense at all. If at all, number one, the plain sunlight is not going to work that well. And if you do put the child in the sunlight, you have to open the child out completely, make the child naked, so
Right.
that there's the whole surface or area is taken care of. The other
Mhm.
thing is, you will not give the child sugar water. Breast
Okay.
milk, breast milk is the only thing that is good for the baby. That's
Mhm.
it. You will
Mhm.
not give anything else.
Mhm.
Breast milk is enough.
All right.
Right. So this is something. This is a misconception where jaundice is concerned, and we have a lot of people who come and argue with us about this. That we will not put the baby under the light, and we will not put the baby under phototherapy, because we think that the child will be okay. My grandmother's child had had this, and my great grandmother's child. I mean, they start quoting all sorts of things, and um, the elders, they also have a say in this, that, oh, well, we used to have this and nothing happened to our kids. There's one thing, that if the bilirubin does go extremely high, there's a thing called kernicterus.
Okay.
Kernicterus is where the child can, the bilirubin can affect the brain, can the child can have fits, and then the child can have brain damage, and then go on to what we call cerebral palsy, which
Oh.
is not very common nowadays because everybody is more or less okay with the phototherapies, but I've seen it happen in the past.
Mhm.
And if it's even more severe than that, then we have something which we call exchange transfusion, where we take out the the blood of the baby, and we transfuse other blood inside. That is also very helpful.
Okay, so apart from jaundice, what we have heard normally that can have, like, this newborn babies first 3 days. But do you think that other problems, newborn babies, they can also have, maybe you would say further after 3 days, or maybe you would say, like, in the 3 months of period of time, if you can highlight, and also yourself you noticed, and if you would like to share something about it.
Well, there are two types of bilirubin. One is called direct and one is called indirect. The indirect bilirubin is the one that can be taken care of by by phototherapy. That can be by breast milk jaundice. Some people have breast milk jaundice by the jaundice increases when they drink the breast milk, which usually goes away on its own, slowly and gradually. Then there are other inborn errors of metabolism, or there are diseases that are from birth. Like, for example, if the mother and the baby have different blood groups, the mother might be A positive, the
Mm.
baby might be B positive, or the mother is positive and the child is negative, or vice versa. That's when there's a breakdown of a lot of blood, and the bilirubin pigment just comes across. Then there's also liver diseases, like where you have blockage of the ducts in the liver, which are causing blockage, and they go backwards, and the bilirubin and the gall, etc., it causes jaundice again. I mean, if you go on, you can go on and on and on, but these are the most common that you will
Okay.
see.
All right. Now, when we talk about breastfeeding, in this present era, maybe new mothers, they wouldn't really appreciate it. Maybe because of some, like, many reasons, various reasons. Maybe those ladies would be working ladies, and they wouldn't be able to pay that much time that they just, could do kind of breastfeeding, or maybe some other complications for the breastfeeding that some new mothers they can have. So I wanted you to just shed some light the role of mother's feed, like, the importance for newborn, and how, like, new mothers can manage, and of course, like, if we want them to, like, what would be your take on it?
Well, the first and foremost thing is that breast is the best, because see, you're not going to ask a cow to have human milk. That's what we used to joke about. But the thing is that, see, a lot of people are nowadays very impatient. They let the baby suck, or they don't suck properly, or things like that. And the first milk that comes out, the colostrum, has the highest antibodies. So it might look a bit thin, and it might look not so substantial, and some people think it's not clear or it's not pure or something like that. But that is the milk that is actually the best for the first few days of the baby. You have to remember that the baby's tummy is only this small. You can see even smaller than this,
Yeah.
so you're not going to try to put in about 8 or 10 ounces of milk inside it, and parents, they think that, oh, our child, the first act of love that the parents have is to give the child something to eat, or to drink, or something like that. And you're actually overfeeding the child if you stuff the child with a lot of milk, and the child will vomit. There can be aspiration, they can have aspiration pneumonias and all that. So the amount of milk that the child drinks on the first couple of days, even if the mother thinks that she's not getting enough, just the sucking of the I mean, the mechanism of sucking is like a mouse. I tell my patients' mothers that there's stimulus in the breast that goes to the brain, And then the brain stimulates the breasts in turn, and the milk is created. But it takes a few days for the actual milk to flow properly. You know, it's not like a tap that you think it's on the first day you're going to get a whole lot of milk coming out. But the thing is this, that what you have to do is, the gynecologists mostly, they think, with respect and apologies to them, that once the baby is born, it's not their concern anymore. The thing is that the mothers have to be told that during the time that they're going to breastfeed the baby, they have to continue taking the calcium they were taking during their pregnancies and the vitamins. Because otherwise, if they're not going to take the calcium, the baby will pull the calcium from their bones, and then that is a precursor to osteoporosis, right?
Right.
And then the other thing is that if they're going to try to, you know, alternate breast with bottle, they will create a condition which is called nipple confusion. Now the baby will be happy to take the bottle because obviously everything is coming nice and fast. And if the baby has to suck on the breast, then he or she has got a lot of work to do. Why should they work hard when they can get something easy? So that's one of the main reasons why children stop breastfeeding. So it's you have to have a lot of patience. And the most important thing is, you cannot breastfeed a child when everybody's bothering you and somebody wants something from you, and you can't you know, listen to anybody properly. I mean, people think, oh, she's only breastfeeding and she can do this and she can do that. No, it's like you have to be relaxed. Sit in your room, tell everybody, look, I'm feeding the baby, don't bother me. Because it's the life of the baby that's at stake, because the baby has to have proper nutrition. Sit down, put your feet up, have a nice rocking chair, watch a movie, read a book, drink a lot of water, because water then acts with the fat, and sort of you can go from here to there like that, and that fat becomes part of the milk. So the thing that I keep on telling my patients' mothers are that you have to relax. The more you relax, the more better your child will get the milk.
All right. Okay. Thank you so much for this information. Now, doctor, if we talk about the baby's weight, and that is very much important. So how to keep, you know, kind of check up that should be the required weight, you know, up to this month to this month. And if the baby is underweight, and what could be the reason behind that? And suppose if the baby is underweight, so what necessary actions, you know, could be taken to sort out this issue?
Well, in the beginning, we always try to call the newborn babies at a shorter interval than others, because we want to see whether the child is drinking the milk properly, there's no malabsorption, there's no other issue, and that the weight is increasing nicely. Now, the other thing is that we have to reassure the mother or the parents that even if the child is vomiting, because a lot of children, they're overfed, they're vomiting, and or they just burp and they vomit out. Even if that is happening, that's not a problem, that is not pathological. If your child is gaining weight and drinking well, you're on the right track. And like this, you know, every time the child comes for vaccinations and otherwise, we keep on calling the kids in, and the things that we do is we measure the height, the weight, the head circumference to see whether the brain is growing very well. And most of the time it's good. But if there is an underlying problem, like for example, we say a congenital heart disease, the child will get extremely breathless when they try to drink the milk. And obviously there will be what we call failure to thrive. So failure to thrive can be a lot of things. It can be heart disease, there can be lung disease, there can be within the intestines, there can be some malformation that happened in the womb, or neglect. The people who, you know, they mix water along with the milk, or they just don't feed the baby at all, and the baby loses weight.
Another problem, another thing, you know, baby crying. So baby crying is normal on what conditions, and not normal and as alarming, how would you consider that? How would you specify that, like, where the baby is crying that's normal and where the baby is crying that's not normal?
Well, babies have certain cries that the mother starts identifying from day one. There's a cry for being hungry, there's a cry for being wet, there's a cry for being uncomfortable. And when those things are addressed and taken care of, the child usually settles down and goes to sleep or is quiet. Now, in cases of colic, let's say, the child will have a little bloated tummy and will scream on the top of its voice, and the legs will be sort of drawn up to the tummy, and it's a typical thing. And then when the baby cries, it's, the mouth goes down and there's a stress on the face. It's not at all like the feeding cry or the nappy cry. Is something totally different. And again, the parents, they can identify that, and most of the time they do come to us in the ER or into the clinic to say that our kid is just continuously crying no matter what we do. And the most common thing that they do is they keep feeding the baby. Now, the baby is crying, the baby has a problem, the baby has a tummy ache, you will not feed the baby, because the more you feed, the more pain you'll have in the tummy. Look at it this way, that if you are going somewhere and eating, and you really are eating a lot, then your tummy hurts.
Yeah.
And then you want to have some medicine, or you want to relax, and somebody's saying, no, you have a tummy ache, you eat some more. It's like that.
Yes, definitely.
You're doing the same thing to the baby. The baby is crying and you're just stuffing the bottle in the mouth and forcing the child to drink. No, you just don't do that. If you think that your baby has a problem and is crying intensely, it's not necessarily colic. It can be, sometimes the intestine can twist in the tummy or anything, but the intensity of crying will be so severe that you will realize it yourself, that there is something pathologically wrong with the baby.
Okay. All right. Now, if I talk about like after feeding, I also remember that I used to have, like, my children, they were so young, of course, once I just finished feeding. So then for my, older one, she used to say, okay, now you have to give a burp to baby, put it on, like, on a shoulder and then give a burp. So what's the thing behind, if you can just explain that, was it the right way to just put a baby on a shoulder and give him a burp? And it's important, and the importance of burp, if you can just explain a bit.
Well, when the child drinks milk, especially top feed, because the parents sometimes, they just put the bottle like this, instead of like this. So the nipple has got half air and half milk inside it. Even when you're breastfeeding, the child is, taking, and even though there's suction on the nipple, there's still some air coming in. Now that air, as I told you, the tummy is very small. So the air bubble could be as big as the tummy. So if it's below the milk, it can actually push the milk upwards and cause, vomiting. And that vomiting can go into the lungs if the baby is not lying properly. So it's always better to, gently, I've seen people, bang the kid very hard.
Right.
I say, oh my God, what are you doing? But it just gently tap, just like if you see some bubbles in a bottle, you just gently tap with your fingers, or in an injection. It's the same way. You gently tap the back of the baby,
right,
just where the tummy is, and the child will burp.
All right. Okay. Other two things, very common problems, but I would want you to talk about it. Baby rash, nappy rash or any other rashes. And what is the myth behind? Is it right or wrong if, baby massages? So should we give massages to baby? And does it, like, of course, affect on kids or babies, bones? So if you can shed some light on that as well.
Let's go first to the rashes. Nowadays, I feel that the nappy rashes are increasing because people are using disposable diapers.
Mhm.
And many times I ask the people, well, when do you change the diaper? They say, oh, every 3 or 4 hours. That means that the child is peeing into that diaper 3 or 4, even 5 times. And by the time they change it, the diaper is so heavy with waste products that,
Right.
you can, what I mean to say is that urine and stool are acidic.
Mm.
If there's even one pee in the diaper, you
Right.
have to change it
Right.
because that acidity will go onto the delicate skin of the baby,
Mhm.
right? And that will cause a rash.
Mm. Right.
Many times I've seen that, the parents are negligent, or they think, oh, well, it's expensive, we'll use 3 or 4 in a day instead of 5 or 6 or something. No, if you are using a diaper, you have to see that as soon as it's soiled, you will change it.
Mm.
There's no left or right about it. If you feel that you don't want to use a disposable diaper, use reusable ones, wash them nicely at home, disinfect them and all that, like we used to do in the olden days. But this is the only way how you can prevent rash.
Right.
The, the
And now
other
yes,
the
the
other
other
question
question.
that you said was about the massage of the baby. Now, there's nothing to do with the bones.
Mhm.
the bones the bones will if there's good mother's milk with a lot of calcium and vitamins, minerals, etc., then that will affect the bones. Yes, what it will do is just like with an adult, the baby gets more relaxed with it. But there's one thing I'd like to say is that when you massage the child, see that you use natural products, because there are some um, you know lotions and things like that do cause
Mhm.
allergies to the baby.
Mhm.
There's
Mhm.
some companies more than the others. I don't want to name names over here, but more many times when a child has come with a rash all over the body, I hear that this and this company has I mean, the lotion of this and this company has been used, and then the child has this allergy. But as I said, it's got nothing to do with the bones. The child is nice and relaxed before you have a bath. Then you give the nice warm bath, and then you put the child to sleep, and then you have 2 hours or 3 hours of peace.
Right, right. Yes. Okay. So, yes, and now, Dr. Shireen, we are running out of time. And I think that for newborn babies, this session was amazing. I also
Thank
just,
you.
some of the myths just been, also been removed that, yeah, about massages purposes and about the other things. And there's a lot more. But now I think for the next session, we would be like, talking about maybe 3 to 6 months. Dr. Shireen, thanks a lot for coming today, for
You're
joining
welcome.
for today's
Thank you.
session.
Thank you for having
Yes.
me.
Have a lovely day. Bye-bye from my
You too.
side.